Spokesperson of Denosa, that is the Democratic Nurses Organization of South Africa, Sibongiseni Delihlazo, who will be giving us their reaction to the amended level 4 restrictions. A very good evening to you, Sibongiseni. Thank you so much for joining us. Welcome to the Globe. First of all, what's your reaction to the President's address earlier on?
Well, thank you, Stuart. Well, I can assure you that not a single healthcare worker is happy with the announcement by the President. I think what the President has announced, basically, is that the status quo remains, but further than that, and that there's the opening of some more windows of opportunity for more spread of infection, which is more work to healthcare workers. I think it's been proven that non-pharmaceutical interventions have not worked in this country, and yet we have not heard nothing from the President on what is to be done to actually curb the laxity that we are seeing in our communities. As we speak to you, social and political gatherings are prohibited, yet these are taking place on a large scale in our country, in public spaces, with no consequences. That is what is disappointing us in this case. And I think it just invites more work to healthcare workers, and they can't even breathe in our facilities. We are just inviting more work in their hands without even hiring more healthcare workers in facilities.
And what's your analysis and observation of how the authorities are handling the third wave of the COVID-19 pandemic?
Well, from a nursing perspective, obviously, you are never going to deal with the pandemic, particularly the spread thereof, if you are not proactive. By proactive, we mean you must go out to communities. Obviously, the issue of contact tracing, which was a serious matter that was followed on in the first and the second waves, that is not happening during this time. And it's only exacerbating matters because there is no curbing of further spread, even in communities. Well, I can argue that there is not enough healthcare workers. Perhaps that could be the reason why we're not doing that. But to just sit in our facilities and wait for community members to come and be admitted, it just exacerbates problems, especially when you are not policing the adherence of protocols in our communities. People attend political gatherings, not wearing masks, not observing the protocols which are set in there, and yet there are no consequences for that. That is what we are very aggrieved about as the organization.
And how do you propose the authorities should handle, the spread of COVID-19 and curb the spread of this pandemic?
Well, it's simple. If you want us to remain where we are, do assure us that you will be tightening the hand in as far as policing adherence. Medical measures have been proven to work. Obviously, if people cannot behave on their own, I think there's a need of assistance from government. We're not seeing that at the moment. That is what is disappointing us. We're not seeing that even from government. And what point must we reach for us to realize that we're at a breaking point? And in particular for healthcare workers, we are very worried about the well-being of healthcare workers. If you look at Gauteng, we don't even have field hospitals. We are still reliant on the facilities that we're having, and we are very much concerned about that.
Now, the medical and the nursing staff were the first to benefit from the inoculation program that is currently in progress in South Africa. Just give us an update as to whether that is working among the nursing staff, perhaps, and whether we've seen rates of reinfection and, God forbid, deaths.
Well, reinfections are taking place, but not to the extent that they were before the vaccination program. We are thinking that the vaccination program has assisted because, as you know, we have reached quite a number of healthcare workers who've been vaccinated. Yes, some are getting infected, and we're not happy about that. But it gives us a bit of peace that, obviously, when they're infected, not too many of them develop severity, and that would need admission, and some would die previously. So to us, the vaccination program, the vaccine has worked, but that it has worked must not mean that we must overwork these healthcare workers like slaves, as we are doing. They need to rest. They don't have time to rest. Some are depressed as we speak. Some are even considering resigning from government and attending psychological counseling out of their own pocket with no assistance whatsoever from government.
Well, a couple of months ago, Denosa expressed concerns that nurses were being warned not to disclose the side effects of vaccine jabs. So what's your position? Have you approached the authorities on this particular concern? And if there are any side effects, are you at liberty to tell us what they are?
Well, of course, we did mention them at the time we did. And our concern was, in as much as it can be, it was mentioned that it's few healthcare facilities. What our concern was that even if it's one or two healthcare facilities, where that was happening, it was out of order. So currently, of course, talks are, that this was raised by our province in Gauteng. And of course, we did iron out the areas of concern, because it was not necessary for whoever did that to intimidate healthcare workers, because we need to be transparent. And by being transparent, we're assisting the vaccination rollout in the country.
Who did that? Who intimidated the healthcare workers against, and warning them against revealing some of the vaccine side effects? Who is it?
From our side, we're told by our members, and we want to protect our members. But the Department of Health did come out and said that it was one institution that they've had that in the private sector. We are still not going to mention that, because we need to protect our members. We must not just not be able to keep matters confidential, especially on matters that concern the issue of their well-being.
All right, Sibongiseni, great chatting to you. Thank you so much for joining us.